Hi guys, welcome to my channel. I hope I'm recording. I have a lot of videos to make today. I wasn't able to make it concise, but I have a few things I would like to talk about today with you guys. So we're gonna start with the upper respiratory system, and after talking about the upper respiratory system, I'm gonna talk about airway obstruction, and from there we're gonna talk about like things people in the medical field do in order to like give you oxygen and have you breathe and all of that. So first, I will just talk about something a little bit random, which is just HSV. Not a lot of people know about this. I mean, I didn't. I knew a little because I went to nursing school, but I didn't really understand it too much. I was just like, what? HSV1 virus? Stay away from me, you know? But yeah, let's talk about it. I'll start with HSV1, which is like I want to say is the herpes simplex virus. Yeah. So I want to tell you guys a funny story first of all about this HSV1. A few months ago, like when I'm a nurse, but I was working as a student, not working. I was a student nurse, and I was working with this student, and he had this little blisters. He had these blisters on like his lips, and I just didn't know what to think. Like I was like, wait a minute, like this can't be herpes, because he's a child. It cannot be herpes. And I just was like, because my instructor was like, oh, he has a cold sore. And I was thinking to myself, is the cold sore different from the herpes I know? Like, but apparently it was herpes, but obviously it's herpes one. But the thing I learned, like recently is like herpes one, like a lot of people have herpes one. They just don't know that it's herpes one. And a lot of people don't know that it's actually very contagious. Like, when I say very contagious, like you can transmit it through touch. So like somebody could have HSV1 and be asymptomatic, and if you kiss them, you can still get the HSV1, the herpes simplex virus one. So what does that mean? Like if you have the HSV1 and you kiss somebody like somewhere else, they can have HSV2. Okay, but first they're called cold sores. What are they caused by? It can be caused by a cold, right? Cold, sun, stress, alcohol. Those are the things I had no idea. Cold, sun, stress, alcohol. Is there something else? Um, yeah. So that's what it is. Wind. So like first, the way it is like fluid filled vesicles. So the vesicles are just like little like tiny little like circle thing, and it's filled with like fluids, and it turns to crusted yellow. It's usually very painful. Some people also call it like night fever or something like that. I think my sister, somebody had it like yeah, so it's like night fever or something like that, and then it goes away. So we will treat it with ice acyclovir if it's really really bad, acyclovir, and yeah, and lidocaine, because like the pain affects your nerve. It's like a nervy type of pain. So the next thing we're going to talk about, so that's that for HSV1. Again, not don't share like dishes, toothbrushes, razors, because obviously you can get it through touch. Okay, I don't know how like people always use towels, and yeah, like you wouldn't want to use someone else's towel. So that's why you don't want to use someone else's towel. Someone else's like a razor. But the dishes, like everybody uses the dishes. Then you have rhinosinusitis. Rhinosinusitis is a fancy word for like having an infection of the sinuses. So what does this mean? Like yeah, so when you're like congested and it just hurts like here. So that's what it is. The sensation of fullness. You might have like headache, like around this area is like you just feel so tired, and you might have a fever, and this could be caused by like a viral infection or a bacterial infection. If it's a bacterial, obviously we'll treat it with antibacterial, but sometimes even like allergic, so we'll treat it with antihistamine. But this disease or this condition is very People don't think about it, but it's very dangerous because it can actually cause like a brain abscess in your head. It can cause osteomyelitis, like infection of the bone in your head. And it could also cause like I said osteomyelitis, I said brain abscess. It can cause meningitis, which is really bad. So so nuchal rigidity and all that. You wanna, like, you'll feel like a certain like pain in your neck. So you want to take care of it. If you're getting sinusitis, you want to take care of it as soon as possible. Yeah, so it can affect infection to your brain, infection to your eye, all around there, where your nose is. It's dangerous, your brain. The next one I'm going to talk about is pharyngitis. Pharyngitis is inflammation, infection of the pharynx, which is like your throat area. Sometimes it's called it's like I have a sore throat, and it's caused by a bacteria called beta hemolytic group A strep. And so it could be so when this happens, the nurse or the doctor will assess or check with like a tongue depressor and look at what is called your uvula. It's like this little meaty part in the middle of your throat. So we'll check it, making sure that like the color, if it's red, inflamed, and we'll look at your tongue and the back and just check overall. And usually this can even cause pneumonia if it goes down. It can affect your kidney, and it can also cause something called otitis media. Like it can affect your middle ear, give an infection to your middle ear. So you want to take care of that too as soon as possible. Or it could even cause so much of an inflammation that it closes your airway. And we're going to talk about obstructions next. I don't know if it's going to be on this video or on the next video. Yeah, so like we're going to treat it with antibacterial, like I already said. Yeah, and what else? It can even cause a rash, so we'll fix the rash, and you might not be able to eat because of the sore throats. So yeah, the soft palate, the tongue, the tonsils. The next one we'll talk about is this one. I actually like it. Like, not that I like it. It makes a lot of sense to me, so much, because actually I knew somebody from work who had like sleep apnea. And at the time I knew what it was from like years ago when I was in nursing school. But I didn't know the like details, but now it makes a lot of sense to me. So he has sleep apnea, and usually people that are at risk of, first let's start, what is sleep apnea? Sleep apnea is when you is like when you go to bed and then you sleep, and at night you actually stop breathing for more than 10 seconds. So like literally you sleep and then you wake up, like you stop breathing for a certain amount of time. And a lot of the people who have this disease, they snore a lot. You'll notice they snore so much, and during the day they're tired, they forget a lot of things, and sometimes they're so drowsy when they drive, they're irritable. And people who are at risk are people who are obese, people who have like a white neck. My coworker really had like a white neck. He was obese, he drank a lot of alcohol, basically living like a sedentary lifestyle. But and he was a male too. That's a risk factor. So if you have this condition, I know a lot of people actually have this condition. The doctor might prescribe something called a CPAP or a BiPAP. Oh my God, it's so nice understanding this, because last year I knew about a CPAP and a BiPAP, but I actually didn't know what it did. So what it does is it will just put pressure to your airway and open it up like at night while you're sleeping, so that air can go through. Because what happens is the muscles in your throat will kind of like flap down, like as if you lay flat on your back, it will like flap. It will just go down on your throat, and you'll stop breathing for some period of time. So that's how they would treat it. But the way the doctor would diagnose this, they will use something called a polysomnography. Big words, but basically it's just like at night they'll monitor your sleep, and put on the what they call the pulse socks to check your oxygen level, to make sure that there's enough oxygen to go into your brain, or I mean just to see how much oxygen, because as you're breathing it goes to your body, just to see if you're getting enough oxygen to your brain, to the rest of your body, and if you actually do have sleep apnea, if you stop breathing for a period of time at night. So yeah, if you have this condition, you want to avoid eating or stop eating an hour before bed, or eating a large meal before bed. You want to try to lose weight, like exercise. I mean, drinking lots of water goes for everything, but exercise, lose weight, stop drinking alcohol, because that's a big risk factor. Yeah, and also see your doctor to get the the BiPAP or the CPAP, because it will really help. Because if it continues like that, then you might have other conditions. Like people with this disease, usually is connected to like hypertension, is connected to MI, arrhythmia. Sometimes people might have a stroke and just die. I didn't mean to scare anybody. Oh my god, I'm trying to stop doing that, because I'm supposed to learn, or I'm supposed to like speak in a way that will not really like get people scared. But we need everybody in the health field, okay? All right, so that is that for for obstructive sleep apnea. Yeah, and I don't want to go into the whole REM sleep, because that's just. So now we'll talk about epistaxis, fancy word for nosebleed. And I have a really funny about this, like epistaxis. Is it epistaxis? I don't know. Like, I am from another country, I say words differently. I was a nursing student, like, and then I was working with a student. I was working with a student at school. We were doing like pediatrics, and my nurse was like, "Go take care of this client who's, bleeding." And I remembered from like school earlier that like I could remember at that time was just put the head up and place the head down, like kind of like pull their head forward. That's all I remembered. And then I just noticed the student was just bleeding and bleeding. I got so scared. I've never seen that much blood in my life. Yeah. So the nurse came in, and then she was like, thank God she didn't scream. Like, if you're a good teacher, you don't scream at people who mess up like that. But she was kind of like, oh no, that's not the most important thing you do. You got to put pressure on the nose. So she kind of took him to the kind of, and then pressed on his nose for a long time. So that's how you're going to treat it. So if you have your family member who has nosebleeds, first of all, you want to know the cause, because it can be caused by like, really dry air, if you're putting in some oxygen without humidification, maybe trauma. So you got to know the cause so you can prevent it. But if it happens, you just sit them up, you put pressure on it for 5 to 10 minutes. If it still doesn't go away, then you can put in a tampon, and it's going to squeeze onto those arteries and close them up. If it still doesn't go away, then you will have to send them to the hospital. And at the hospital, they might do suctioning just to look at the nose to see that everything is okay, to see what they can do. But decongestion is also help, because it shrinks those blood vessels, because you got blood vessels everywhere in your body. So but the vessels in your nose, so that the bleeding can stop. Okay. So then the thing with the elderly too is like I am going to talk about the elderly now. They have like they are prone to a pharyngitis due to what is it? Due to GERD. Sometimes to excuse me. They have low immune function, so they're prone to infection. All the signs. So we really want to look, or if you have like an elderly parent, you want to check them out and just make sure that they don't get like infections, or try to protect them from those infections. And the voice too, as you get older, or as an older adult, your voice deepens due to the muscle around like that area. So yeah, that is that for upper respiratory problems. So now I would like to talk about airway obstruction, but I feel like it would be best for me to put it in the next video. So this will be part 1, And I'm gonna post this not maybe with a nice title, but and now you guys watch out for part 2, where I'll talk about like obstruction to your airway, and what you might see at the hospital. Because like sometimes we live out here, and there's the hospital, but then you go into the hospital, you're all skeptical, you don't know what they do. It's good to be informed and know about this stuff. But thank you for watching my video. I'll see you on the next one. Bye.